song is addictive. In case you don't want the Holy Ghost upon your life, you better don't play this. Cause the CD I go blow. The Holy Ghost blazing. You hear that?
Lockdown in the building. It's the one and only Franklin Edwards. Move your body. Move your body.
This is Mrs. Biola Polosi, the chairman of Healthcare Providers Association of Nigeria, Lagos State Branch. One thing I want to tell the citizen is that health insurance is needed, is needful. We can no longer continue on the path of out-of-pocket expenditures every time we need to access healthcare. No, we should plan for it, and we should embrace what the federal government has already mandated into law, that every Nigerian, every resident, every citizen should take one form of health insurance scheme or the other at the state level or at the federal government level. So I want to advise residents in Lagos State in particular, please make sure you have one form of health insurance or the other. It's like saving for the raining day. We should not have the attitude that I'm not sick now, why should I be paying in advance? Yes, we need to prepare that way. If our healthcare sector is really going to deliver on optimal health outcomes, then Nigerians should embrace health insurance and begin to make sure that they plan for it. This nation belongs to all of us. We must contribute a meaningful quota to make sure we do the needful for our country when we are still able and capable. Going outside, jackpotting will not solve the problem. It's Nigerians that must build Nigeria. Biola Polosi, I'm a pharmacist. I'm the chairman, Healthcare Providers Association of Nigeria, Lagos State Branch.
We must provide value. The value must be feasible to the people in the rural areas. We must raise awareness in all the media, not just social media, traditional media, so that people can see the value of investing in health. People of my generation, for example, we grew up believing that the missionaries and government should be responsible for healthcare. But each individual must learn that healthcare is an important thing. Not like you set money aside for the education of your children, you set money aside for your health. And so, the greater the awareness, the more the number of people that will eventually key into health insurance. We must also ensure that in health insurance, that the little fund that have been raised is properly spent, so that large number of people who have actually invested in health insurance must see value in what they get. Because it is when you do not get the value of what you have paid for that you become more skeptical. Currently, it is the heart that has made a number of companies to actually register their people, organizations to register their people in the health insurance. It is important that every stakeholder play very key role in ensuring that value is given, value is mentioned, and value is seen. When people start to see real value delivered in the healthcare space. My name is Leroy Bale. I'm a professor at the Business School, Netherlands. Thank you.
My name is Dr. Austin Aipo, the president of Healthcare Providers Association of Nigeria. Health insurance is the way to go if you want to achieve universal health coverage in Nigeria, which is set for 2030. Because without health insurance, it will be difficult to achieve that. The reason being that out-of-pocket payment is being obsolete. A lot of Nigerians can't afford to pay for their health. And so the way to go is to be able to have universal health coverage. And so this conference is good because it's going to promote what the governor of Lagos State did by signing the executive order to make health insurance compulsory. And also the National NHI Act also made it compulsory, and I think last month or so, the President, Bola Ahmed Tinubu, also passed a law to say that health insurance should be made compulsory for Nigerians. We have been doing our best, and we keep working. We can't say we have gotten there, but one thing we've been able to achieve over the years, because when we started in 2001, the health insurance in Nigeria was not compulsory, and we kept fighting and fighting And thank God in 2022, a law came up to say that health insurance is not compulsory in Nigeria. And so I'm sure we are moving, we are going. But there's still much to be done. We still need much of government cooperation and government input and the political will for them to be able to push this compulsory health insurance for Nigerians. Dr. Austin Aipo.
Attention, please. The song is addictive. In case you don't want the Holy Ghost upon your life, then better don't play this. Cause the CD I go blow. The Holy Ghost blazing. You hear that?
Lockdown in the building. It's the one and only Franklin Edwards. Move your body, need your TI. Move your body, need your TI. Move your Empire. Baba God don't bless in this place, yeah. God don't bless you, make you carry your body, come to the dance floor. Down 360, move 180, let's go 90. Oh yeah, put your hands in the air, make you move to the right. Move your body, need your TI. Everybody move to the left. Move your body, need your TI. Move your Empire. Drop on the floor.
You tell me you have enough a reason for whine it, enough a reason for dance well. You have enough a reason for whine it, enough a reason for dance well. You know, give it to me one time. Give it to me. You tell me you have to give it to me one time. Give it to me two times. Too much money for me pocket to spend. The joy and happiness in my loan can extend. To me everybody them have be asking, how comes me life getting better? Now the whole of them want to know how far. Can you hear it? You hear it, yeah. Can you hear me feel it?
Holy girl, move your body, need your TI. Empire, move your body, need your TI. Move your Empire, everybody make one of the dance they go. My own not to play guitar. Baba God don't change my life, I go play guitar, I go knock on well.